Welcome back to Melisia Talks, where we talk all things uniquely you. For the month of May, we have been highlighting nurses as it is Nurses Month. So we are looking to ensure that we continue to celebrate and love on our nurses. And specifically, we've been looking at nurse practitioners and all that they can do to help you in your healthcare journey. And so today, I am going to look at autoimmune disorders. We don't usually hear a whole lot about autoimmune disorders, but it's very unfortunate that a lot of people are presenting with various autoimmune issues, whether that be due to genetics or due to stress or due to lifestyle, whatever that is. There are a lot that we are seeing now in the healthcare arena. And so, when it comes to nurse practitioners and what we can do to assist you with your autoimmune conditions and even diagnosing, that's what I'm going to cover today. Now, what is an autoimmune disorder? When we talk about those types of disorders, it pretty much in lay terms, the immune system, which helps us to fight off, infections, things of the sort, viruses, illnesses, is attacking itself. So it is in overdrive, for lack of a better word. That immune system is operating too much and we want to slow it down. And so, unfortunately, there are many different types of autoimmune disorders, such as rheumatoid arthritis, which can affect the connective tissues and joints of the body, lupus, which could be in different forms, such as systemic, which can affect many different areas of the body over time, or we can have discoid or cutaneous, which just affects the skin when it comes to lupus. And we do also have something such as multiple sclerosis, and there are many different forms of that, 4 different types to be exact. One can be more severe than another. And then also, thyroiditis, which is Hashimoto's thyroiditis, which affects the thyroid gland. It's unfortunately the immune system attacking the thyroid gland. Now, those are just a few examples, but there are many more. But overall, what can your nurse practitioner do? We can play a very pivotal role in managing your disorder. That could be by way of patient centered care, that could be by providing holistic care, also making that initial diagnosis, and then helping you along with your provider that is a specialist, depending on what that disorder is, planning that overall plan of care for you. So overall, because it is right now, they say no cure for these, it can be long-term management that will need to include that multidisciplinary approach, again, meaning multiple providers being able to assist. Now, from the believer standpoint, that's within me and my spiritual beliefs, I believe that God can heal anything. Although we are discussing many different things this month as it relates to that nurse practitioner and helping, first and foremost, I believe that the God that I serve, the God of the Bible, is a healer and his word is true. All right, so I want to make that clear in my beliefs and as I look to help others throughout their various processes. Now, so overall, comprehensive patient assessment. We're going to look to do that initial diagnosis. We are skilled to identify various signs and symptoms of various autoimmune conditions. And so that overall will entail us looking at physical exams that are very thorough, detailed patient histories, looking at evaluating symptoms such as fatigue, joint pain, rashes, any inflammation that can be unexplained. All of that is a part of that initial diagnosis. And then we'll also look to order various diagnostic tests. That could include laboratory tests. Many times when we are looking at autoimmune disorders, we're thinking about inflammation, which is what I just said, that unexplained inflammation. So we're going to get laboratory tests that look to tell us whether or not you are experiencing inflammation. And that could be an ESR, which is also called an erythrocyte sedimentation rate, excuse me. And then also a C-reactive protein or CRP, and even an ANA. That also looks at inflammation, usually specific to rheumatoid arthritis. But then overall, depending on what we're trying to look to diagnose, we would look to draw specific antibody panels regarding that. We can also look to get various imaging studies That could be a CT scan, it could be an ultrasound, it could be an MRI, all looking to diagnose and monitor this disease progression once it has been fully diagnosed. Now, when it comes to your individualized treatment plan, we've looked at now the comprehensive aspect with the initial diagnosis, the diagnostic testing, but now how do we look to individualize this plan for you? We can then look to manage various medications that you might have ordered with your specialist, and that could include an immunosuppressant agent. As I just mentioned, you want to ensure that you are thinking about the immune system because, as I said, it's like an overdrive. And the immunosuppressants can help suppress that immune system and manage it. We also have corticosteroids or steroids that can be utilized because, as I mentioned, inflammation is a big part of many autoimmune disorders, and that can help manage the inflammation that your client is dealing with. And then there's other things that we can look to utilize, such as immune modulators, and again, looking to pretty much affect that immune system, alter it, modulate it. So, those are some things overall that we can do to look to decrease the symptoms and slow the progression of the actual autoimmune disorder. The next thing that we can look at regarding that treatment plan are the various symptoms and managing the symptoms. These look to address and treat associated symptoms such as pain, fatigue, or even sometimes the mental aspect that can come with autoimmune disorders, and that can be seen in depression or anxiety. And I will talk a little bit more about that in a moment. But overall, looking to tailor the treatment to that individual client. Another huge factor here that NPs can look to and assist with is the lifestyle modifications that are necessary. This educational aspect is critical because oftentimes now in our society, lifestyle choices and lifestyle, activities can lead to a lot of this. As I just mentioned a little while ago, stress induced autoimmune disorders are real. So, what can we do to reduce stress? That is what we would look to encourage our clients and educate them on. Finding ways to get physical activity involved in our lives, finding ways to avoid various triggers that can exacerbate the symptoms or look to flare up or the various symptoms. Also, thinking about dietary adjustments because that is going to be very key when it comes to your lifestyle. Because we do know there are some foods that can lead to inflammation, right? There are foods that can unfortunately affect the body when it comes to high fat foods, sugary foods. All of these and more can affect our clients overall. So, that is going to be key when it comes to educating them on lifestyle modifications. Moving more into the education aspect of it, because it can be complex when explaining autoimmune disorders to our clients, it can be confusing to them. And we do sometimes know that our specialists may not be able to break it down in lay terms for our clients to understand. So, that NP, we are there to bridge that knowledge gap by explaining the nature of the disease and its chronic nature, looking to teach our patients how to self manage their condition, also including how to recognize early signs of flare ups. And again, being mindful of that medication regimen and potential side effects because we know that side effects can occur with our medications. And so we want to make sure that they understand what to look out for and when to report to the provider. And then finally, here, we want to always make sure that we are stressing to our clients compliance, and that is adhering to the medication regimen. Even if you feel like you are doing well or you believe you want to stop the medication, just talk with your provider first. That's all we ask for. Speak with us first so that we can walk this, process out with you as you look to be weaned off the medication or eventually stop it, or just find ways if you have to continue it to maybe decrease the dose, whatever it is, or the reasons why you feel you want to not take it. We can work with you and understand that. Overall, I just want to reiterate here again, I do believe in the God of the Bible and that healing is the children's bread. And so, as a provider, I still have my spiritual beliefs first and understanding that healing and how God can heal any aspect. He's already done that in His Word and in the covenant that He's provided with us or that He has with us when you one, accept his son as your Lord and Savior, Jesus Christ. So overall, that is where I stand, but I still understand that with the medical aspect of where I am trained, that there are things that we still have to do in the natural as well. So just wanted to reiterate that. Now, coordination of care. When it comes to that, I've mentioned already those various specialists. This could include a rheumatologist, your endocrinologist, especially with that thyroid issue, dermatologist, and even other specialists that can be seen or consulted during this time frame. Uh, Having, of course, that provider there looks to ensure that seamless approach. We look to share that patient data, update any care plans, and overall advocating as a team for our clients. Having this coordination of care, does help as it relates to, that continual uh, transference of information and ensuring that one, nothing gets missed, because unfortunately we have heard that sometimes our clients get, for lack of a better word, dropped in the cracks, because of the lack of the transference of information. And this is where, if we're working together, we can ensure that we don't have that happen to our clients. NPs can overall look to monitor that disease progression with continual evaluations, ongoing follow-ups to check for, any complications or increased symptoms. So overall, looking to monitor that progression with our clients and adjust the treatment if necessary, because we do understand that sometimes the treatment methods have to be adjusted, and we want to make sure that we're monitoring for that. And then another thing is looking at the lab results and continuously tracking labs, especially when it comes to autoimmune disorders, because they can affect various organ systems within the body. And whether we're looking at the kidneys, we would want to ensure that we're tracking those labs. And our main labs, when it comes to the kidneys, include your blood urea nitrogen, or BUN, and also the creatinine, and then overall functioning, the glomerular filtration rate, or GFR. So that's just one example of how we look to monitor organ function, but that's what we would look to do. And overall, looking at the medication effects to ensure optimal outcomes. I mentioned, of course, that mental aspect of our clients due to the fact that these autoimmune disorders can be chronic in nature. You want to always ensure that you're addressing that mental and emotional health aspect of our clients. We always have our usual screening for depression, screening for anxiety, which can be common in some of your autoimmune clients. So you want to ensure that you continue to do that. Also look to refer your clients to various therapists, support groups, and ensure that that emotional support is there as they go through the uncertainties and also the challenges of whatever they have been diagnosed with. I mentioned that advocacy approach and also health promotion. One way that NPs can assist here is by raising awareness, and that can include increased public and professional awareness when it comes to autoimmune disorders, because oftentimes they are underdiagnosed or even sometimes misdiagnosed, because some people just don't understand the symptoms that they might be presenting with, that be the client and even some providers, right? So you want to make sure that we're looking to raise awareness in these areas. And then various ways to prevent the various autoimmune disorders. We do understand sometimes if it's a family history or genetics, there could be ways to reduce it. If it's potentially going to be something stressful over time, how can we continuously find ways to ensure that we prevent these things from happening? I talked about physical activity, stress reduction activities, things of the sort. So overall, you want to look to ensure that you are reducing that risk reduction, and then also early screenings. And then a couple of last things here when it comes to research. We know that this is ongoing when it comes to various autoimmune disorders. There are many clinical trials, various therapies that are always cutting edge that NPs can look to offer our clients. And so that is something you want to be mindful of and ensuring that they are educated on that. And then also, how can we manage certain challenges? I mentioned in one previous episode regarding the cost of things and those social determinants of health with our clients that might have barriers as it pertains to access to care, whether it's from their environment or not having the resources to pay for the care or not having the transportation to get to where they can get care. There are always going to be complexities that we have to manage. And so those are some things that we're always thinking about and how we can look to find ways to, jump over the insurance hurdles or be mindful of the financial assistance programs that can help our clients. All of that is what we're looking to do as we manage some of the challenges. And another thing here is the complexity of the disease. Sometimes, as I mentioned, it can affect various organs, so it can be multi-systemic or affecting multiple systems within the body. And so it can be unpredictable. And that is where we have to ensure that we understand getting that secondary expertise from that specialist is going to be key, and working with them throughout this disorder. And so, overall, we nurse practitioners are indispensable in the management of autoimmune disorders. Our ability to blend medical expertise with a compassionate approach ensures that patients receive the comprehensive care that they need for their lifelong condition. Overall, as I mentioned, we look to focus on education, advocacy, and individualized care, overall, looking to empower that client to live healthier and a more fulfilling life despite the challenges that an autoimmune disorder might bring. And so, overall, that is the month of May. And this is our last episode for this month. We have 5 Thursdays in this month. And so, I'm going to take the last Thursday off and come back bright and early and ready in the month of June with more informative and exciting episodes. So you do not want to miss the month of June. It is an amazing month as we move into summer. All right, so this is Melisia Talks, where we talk all things uniquely you. Until next time, bye.